Hi everyone, welcome back to my channel. I'm Casey, and if you're clicking on this video, you probably are going to have some sort of knee surgery or maybe ACL reconstruction surgery. So I just wanted to make this video because when I was about to do my ACL reconstruction surgery like 6 or so months ago, I was looking around for advice on like how to manage it better, and I don't know, I thought this might help someone out there. So yeah, but I'm not a doctor and I'm not going to be a doctor anytime soon, so please don't take my advice if you think it's harmful for you, and always follow your doctor's advice and listen to them for what you really should do. I'm just giving tips on how I personally managed my ACL surgery recovery journey, and I think this will probably be more relevant for people that are living alone, because a lot of my tips revolve like around me being alone after my ACL reconstruction surgery. So yeah, this video will be in 3 parts: before your surgery, the day of your surgery, and after your surgery. It will obviously revolve, like I said earlier, around my personal experience. So to give you some background, I was discharged the day of my surgery. I know this works differently for different hospitals in different countries and whatnot. So what I am saying and what happened to me might not be applicable to you, but yeah, I was discharged the day of. I was put under general anesthesia, and I also had like a nerve block in my thigh area for the ACL surgery. I used the patellar tendon graft. I didn't tear my ACL. I didn't tear my MCL, so it was just my ACL. And I used a patellar tendon graft. My living situation was that I was alone. I did have some help after the surgery, but for the most part, I was alone. And yeah, so I think if you're about to go through a similar experience as me, then this might help. So my first step is that you should probably block out at least a week, ideally maybe 2 or 3, where you don't have to walk a lot. I know like your job might require, or your school might require that you walk a lot, but like try to schedule your surgery so that it's during a time when you might not have to do that. Because at least from my understanding, after your surgery, you are vulnerable to like re-injuring yourself if you have an accident, because you obviously can't rely on that knee at the time. So that's why I would block out time and try to schedule a surgery around a time where like you don't have to walk too much. 2, I would also block out a few days of like no intense thinking. And now this is maybe my own personal experience, and everyone's probably different, but how I reacted to anesthesia was that I was very like, my mind was very cloudy and I couldn't think straight. Like I couldn't form full sentences for like a day or 2 afterwards. So even if you're like at home and just sitting or whatever, try to make sure that you don't have any schoolwork or any like work to do during that time. It might be nice to just like relax, because your brain might be a little bit foggy afterwards. And also, if you're taking painkillers, which you probably will be, some painkillers might have that effect on you. At least mine did. So it might be a good idea to block out some time to not do anything brain-wise as well as physically. 3, I would probably meal prep and freeze a lot of food. This is generally a good thing to do, right? Like meal prepping, but especially for after your surgery, you don't want to be standing or walking around a lot, and you definitely won't be having like your hands free, especially if you're on crutches, to be like cooking and whatnot. So it would be good if you prepped all your food ahead of time, and that could save you a lot of trouble. For number 4, I would say that you should probably prep some sort of like an ice pack. I think your doctor will tell you this anyway, but have some sort of like ice pack or like ice situation, because you will have a lot of swelling in your knee, obviously, due to the surgery, and the ice pack will help with the swelling, and you'll probably have to use it a lot, like all the time. Personally, I was told by my doctor to have this like ice machine thingy that circulates ice water on this like blue pad. I don't know. I'll enter a picture because I don't know what to call it. But I was given this like ice water circulating machine that I put on my knee, and it was good, but the only problem that I had was that I didn't realize that I would have to refill the ice tray every few hours or so, which was kind of a pain in the butt because I couldn't get up easily and go to the freezer and fill up ice, like especially using crutches and all. So if I had to do it again, I probably wouldn't purchase it because it was like $140 and it was much harder for me to have to like put ice in the bucket and whatnot. I think there are other options that you could do. You could just use like a normal ice pack, but probably prepare like several so you can rotate them whenever they freeze, defrost. But okay, if your doctor tells you otherwise, then do what they tell you. For number 5, your doctor will probably ask you to use crutches a lot, and crutches are great because otherwise how would you move, right? But I might suggest getting like a wheelchair, and preferably one that has like the wheelie thingies on the side, not the ones that you have to have someone push you, because I don't know, that's kind of hard, right? Because your knees are not working, so you have to use the other leg. Basically, try to get the wheelchair that has like the wheel thingy, especially if you live alone. A wheelchair is probably not necessary if you have crutches, but you can rent a wheelchair, I think. At least in the US and where I was, I can rent a wheelchair. I got a wheelchair I borrowed from somebody else, but the reason why I say this is because, for example, let's say you have like a water bottle across the room. When you get up from your bed or like your resting spot, with your crutches, it's like hard to carry things around. So I use the wheelchair to just get across from my room and like bring stuff or like bring food. I would just put it on my lap and like wheel myself back to the side, stuff like that, you know, so it could be helpful. 6, this is kind of an obvious one, but if you have stairs in your house and your bedroom is upstairs, for example, it might be worth it to temporarily make like a nesting spot downstairs, because stairs will be hard because you're on crutches and your surgery leg is like not usable, at least for the first week or so. And then you might fall. You like have the risk of falling if you are using stairs a lot. So consider making like a very comfortable nesting spot downstairs. And kind of related to that, my 7th point is that remember to also, well, this is just a recommendation, you don't have to, I guess, but you could have like in your nesting spot, I would recommend you have a bunch of water and food and other snacks nearby so you don't have to get up as often, and just keep things within arm's reach so it's more convenient for you. 8, this might not be true for everyone, but at least after my surgery, I was told that was very important. I keep my legs straight because they didn't want to run the risk of like my leg healing a little bit bent. So I had to do this thing where like I had to prop my leg up somehow, even though it was kind of uncomfortable sometimes. So you might consider getting like extra pillows and whatnot so you can stack them up and lie down with your leg propped onto the pillow like this, so that you can let gravity have your like leg kind of get pulled down and your knee not like bent and heal weird, if that makes sense. 9, make sure that your bathroom is accessible as much as you can and try to make it like slip free, because I nearly slipped a few times, which is not a good thing, you know, when you're using the bathroom. And maybe, if you want, don't be embarrassed, don't be shy, just in case, you might want to wear like those adult diapers, at least for like a few days, because like, I don't know, it's hard to like make it to the bathroom if it's far and whatnot. Don't be afraid, don't be embarrassed, you can do it if you think it'll make you feel better. You probably won't like wet yourself or whatever, but it might be helpful to have that extra safety net. And 10, this is like not necessary at all, but like if you're bored out of your mind and you think you will be, just find things to do during the time where you're just like laying on your bed for like a week recovering, okay? For the day of the surgery, the first one is that I would probably ask that someone pick you up. You could probably go there alone to your place, but it's probably better if you have someone pick you up, ideally with a wheelchair and whatnot, so they can help you get around, put you in the car and whatnot. Also, like if your brain is foggy from the anesthesia or other drugs that you might be on, then you might not be thinking straight. So definitely don't drive and whatnot. I think your doctor will tell you that very clearly, to not do that after your surgery, and you're not allowed to for like 3 weeks or something like that. At least in my case, no MCL tear, patellar tendon graft, and whatnot. So have someone pick you up. This is very specific, but I'm going to demonstrate how I believe is the safest way to get on a car, because I did not anticipate getting on a car to be as hard as it was, because obviously you have to keep your knee straight, not bent, and you don't have a lot of leg room if you're in the back seat. It's just a pain in the butt. So I'm going to demonstrate it to you on my bed, and it's going to look really awkward, so please excuse me. Hello, I'm about to demonstrate how I think you should get on the car safely using my bed as a car seat. Well, actually, you can get on your bed like this too, if you want. But how I did it is I had to keep my knee straight, and I had a knee brace that probably went down to like around here, from here to here. So you could use a rope if you like can't bend over or something, but I grabbed, oh, you can't tell. Well, actually, you get where the knee brace is. I grabbed it from there. I would lift my leg up like this, slide it onto the car, push my body in, and then put like my other leg in, if that makes sense. That's how I would get on the car. I think it's pretty safe if you can be flexible. For getting on your bed, I would probably recommend doing this thing where, oh, if you want to see my knee, this is what it looks like 6 months post-surgery. I would take my right knee and kind of like hook it under my left knee, my injured knee, and swing my body over like this. That way I didn't like bend it. If you wanted to, you could probably like use a rope or something, like your bathrobe or something random. Grab it and tie it around your bad knee, lift it up so you can be straight, and place it on your bed, and now you're on the bed safely. Something to think about. The third tip for the day of the surgery was very like specific to me. I remember the day of my surgery, I thought, oh, this is not bad at all. Like, this is something that I could easily tolerate. What I did not consider was that like I had a nerve block, meaning I think they put anesthesia like locally, I think, around my knee area. They injected something in my thigh, and that meant that I was quite numb in that area. So I didn't feel any pain, but that nerve block will wear off and you will have like oral pain medicine instead. But during that phase between like the nerve block wearing off and oral pain medicine will hurt a lot. So because the day of I thought like, oh, this is fine, I told my friend that was supposed to come in the morning the next day because I didn't want to bother them, because it was like, I don't want to bother them unless it's necessary. I told my friend, you don't have to come in, like I'll be fine. It's actually really manageable. Don't make that mistake, because it's very hard the next day, and it's quite painful once like that nerve block wears off and you have to rely on oral pain medicine, at least for the few days when the wound is like healing and there's like a lot of stitches there. Very painful. Try to avoid doing things that cause pain, obviously, and if you can, get help, and at least for a few hours a day have someone come in and help you with like tasks that are going to be the most dangerous for you and have the highest risk of you falling or re-injuring yourself. For example, like going to the bathroom or like making food or bringing food to you. So don't think it's easy peasy. It gets much better, don't worry, but like at least the next day and the next few days afterwards, be prepared to be in a decent amount of pain, even with like painkillers. For after the surgery, I have a lot about like the recovery journey afterwards, like physical therapy and whatnot. But for the sake of this video, I just want to put one thing that I want to mention. And this is a combination of like my previous knowledge as like a public health major at Hopkins and whatnot, because like we study this a lot. And yeah, but you will probably be given like opioids or narcotics for your painkillers and really make sure to take them as your doctor ordered it. Please do not take more, and please make sure like the timing is correct and whatnot, because the last thing you want is you to have an ACL surgery and then like become addicted to like pain medicine afterwards. At least from personal experience, it's quite easy to feel that like desperate need for the next pill, I guess, and I can kind of understand why like addiction happens. And I guess what I'm trying to say is stick to the schedule that your doctor gives you, even if it's uncomfortable and painful for a few days. Don't use more than necessary. Definitely guard your pain medicine, because you also don't want that to go into the wrong hands. And I think this is something that the pharmacist may or may not tell you, I don't know. But like, you don't want your painkiller to go into the hands of like people that might be abusing it and whatnot. So guard it, keep it safe, take it as your doctor requires. If you're in a lot of pain and you think you really need more than that, consult your doctor obviously before you make any like dramatic moves and make decisions for yourself. As for my final finishing thoughts, if you're scared, don't be scared. It's okay. You're not gonna die. It's gonna be fine. It's kind of annoying that you're needing to have the surgery in the first place, but it's okay, because this is a very common surgery, and I'm sure like your surgeon has done this a million times before and they're very confident in how they do it. And from my understanding, like the chance of it failing is pretty low, so like don't worry about that either. If you're feeling discouraged, I mean, sometimes I still feel discouraged too, because I'm still trying to recover and I'm not at like my 100% yet, even though it's been like 6 months. But if you like, it sounds kind of hypocritical coming from me, but if you feel discouraged, just think about how unfortunately this has happened and now you can only focus on recovering. And when you're focusing on recovering, you will learn a lot about like resilience and whatnot. And in my personal experience, I feel like, I mean, my goal is to become a doctor, as you may or may not know if you click on this channel. And I feel like I have a much better understanding of like chronic pain and like how slow recovery is. I feel like I have a new sense of empathy for anybody with any sort of like knee problems, because of all the inconveniences that come with being disabled temporarily or chronically. And yeah, you'll find that, I guess at the end, it sucks that it happened, but like you'll probably get something valuable out of it. At least I hope so. So yeah, don't be scared. Good luck. You can reach out to me if you need emotional support, and bye, good luck. Oh, sorry, one more thing. If you like my video, please consider liking and subscribing, because that would make me happy. Thank you.